tie from ayedi Premature Babies aka Kaba Ajina Koya. Sorry, Babies champion, aka Kaba, Ajina Koya, Niesienra, Niesiene, Ebekwakusi Sen, Ewo Asempa, 94.7, Kaba, Kasa.
Good afternoon, Accra. Good afternoon, the nation's capital. And good afternoon to you, wherever you are, however you are tuning. Yama Hamo Akwaba Dibai Kusi Senso Wasempa 94.7 with yours truly, Kojo Kaba. Is a brand new man. The Lord has been good indeed. His mercies endured forever. Shawan can't say that journey will be easy. But what he told us, that he will be with us every step of the way. Obra kwantu no nyankopon anka kire se be ya hogono so esanse sa kwantiano eso fa edin pa nanso so we anam ntuo mu ene ye kone ye banyina asafo Yehowa one ye wo ho ene ye June 1 ekusi se na wienso atena se bi emidi ni kwadwo asare ba for champion Kaba Productions by Dominic Isiebo Nana Chumber Manana Kwada Direnji DJ Yayo Bla Alec Social media Visual production assistant so by Ingo Juma and I am Hawa Kwaba Diabe Kusi Senso from now till 6:30. It's our pleasure to come your way with the best of information. Get you educated. I won't come across Ghana. Near S3 will move in Biasre. No see about Pemuana Yakramo. Unyamini Ashabusumi for me. Pie bonus that is Afri 2017. Abusumin Sian Yeremi, Akabusumin Siana Fina Coneria. Ya 1 year Shasipano. 1 year in Baby Pa. Ebenezer Babia Asafu Yehoa, what do you be doing here?
All right, we're bringing you the AM News now. My boys are all set, Ayeyi and Seth. Are you ready? Yes. Okay, so who's reading the first story for us? All right, go ahead.
The lack of infrastructure is affecting the academic work at the ENT Nose and Throat Nursing College in Kumasi. The students have to share classrooms with the general practice trainees at Komfo-Anokye Hospital, Nursing Training College. They also have to contend daily with heavy traffic to and from their hostel, which is several kilometers away from campus. Nana Asenso Mensah has more in this report.
ENT Nose and Throat Nursing College was established 16 years ago to provide advanced specialist training for nurses. It, however, lacks basic facilities such as classrooms and hostel facilities. Students share facilities with Komfo-Anokye Nursing Training College, which comes with a lot of inconvenience. They say a clash of lesson hours sometimes compel them to watch tutorials on their phones and other gadgets. Josephine Esidugan is one of the ENT students.
Living on campus is so stressful since we don't have a classroom for ourselves. We have to be moving to the auditorium for lectures. Medical students will come around and then we don't know where to sit to learn. And then with accommodation, we don't have accommodation facilities as a school. The school has been in existence for 16 years now. And then we have to travel all the way from Ebuakwa Menchia to this place. Traffic at Tano, so those who know Kumasi would bear with me. It's not easy living on campus with the ENT. And the second years, we also don't have accommodation accommodation. So you have to go and find places, rent out places, and then go and stay. So the ENT school, the administration is doing well, but with our accommodation and then our classroom situation, it's really affecting our studies. Since sometimes you have lectures and you go to the auditorium, medical students are having lectures there, and then we don't know, so we have to cancel lectures. And at the end of the semester, we have a curriculum to complete. So when it comes, we are not able to finish the whole semester program, and that's really affects us.
Management admits the situation disrupts the academic calendar, which makes it difficult for lecturers to meet curriculum deadlines. Abdul Rahman Shaban is principal.
We don't have a permanent accommodation. So we are in the premises of the Nursing Training College. Well, somebody will say that we are a government institution. We are in that premises. The school is a government institution, so the premises is for all of us. But because of the numbers, it will be better if we also get a space, a plot somewhere, and put up our own institution, especially accommodation for our students. Currently, our students have the opportunity to be accommodated in a private home for a year, and after the 2 semesters, they have to go and hire accommodation somewhere else. That's not very good for the school administration. Better, we would have loved to have them together, but because of the fact that we don't have accommodation, they are scattered all over. And to get them together, especially when they have left and we want them to come back, is very difficult. That's the biggest challenge.
Anas and Sumensa reporting for JoyNews.
Health authorities in the Ashanti region say they will help reduce and manage preterm birth. Regional Director Dr. Emmanuel Tinkran says this can be achieved through the good qualities and accessible healthcare services backed by the right equipment. Mahmoud Mohammed Nuruddin reports.
Preterm babies are babies delivered before 37 completed weeks from the first day of the last menstrual period. Each year, about 25 million babies are born too soon around the world. Sadly, 1.1 million die from complications, and those who survive may face life challenges. Ironically, more than 75% deaths in preterm babies are preventable. Dr. Tenkorang says the situation is worrying and needs proper attention.
We've not created the necessary awareness for people to understand and appreciate that we need help. And that's exactly what we are doing, because the figures are quite high, and that's the reason why we want to announce that there's a need for better partnership between the health system and then other partners to address this. What can the other people do? Pregnant women are always with us. They start from homes. So there's a need to educate them to understand that they'll have to attend antenatal clinic. Once they come, there are certain interventions that we have to put them through. We educate them, and then we give them certain medicines and other things that will promote their health.
Ensuring preterm babies survive is the collective responsibility and simple strategy the Health Directorate wants to adopt. Here is Regional Newborn Coordinator Dr. Rita Fosu Yeboah.
We don't know the cause of prematurity, but what we know is that things like adolescent pregnancy, or if you don't space your birth intervals very well, all these things can lead to prematurity. Or maternal health, maternal nutrition, maternal hypertension, diabetes in pregnancy, anemia in pregnancy are all contributing factors to prematurity.
She says education and advocacy in communities and hospitals would make a difference. Mahmoud Mohammed Nuruddin reporting.
In other news, the National Identification Authority has postponed the commencement of the National ID card registration exercise to December. Earlier, government had indicated the exercise would commence this month, but the National Identification Authority says Parliament will have to approve a legislation to allow for changes to the registration documents before the exercise can begin. Chief Executive of the NIA, Professor Ken Atefua, says a second legislation will be introduced to the House after the President signs the approved one into law.
What we want to do is to amend the form which we'll use to take your biographic and biometric data to allow us to include a digital address system, email, telephone numbers, and those kinds of things. Now, because the parent law must be changed first before the subsidiary or the subservient law, that is the form, the LI, can be changed. We have now changed the parent law. When it is signed by His Excellency the President, assented to, and it becomes law, then and only then can we go to the amendment of the form itself to capture the kind of data that I talked about, digital address, email, telephone number, the things that were not on the old form and not required 8 years ago. This time we are going to seek to capture those. So when the President signs the law, the bill into a law, then we'll lay it before Parliament, and then we follow that. So we will be able to announce exactly when the registration will be rolled out the moment the LI passes, or Parliament passes the LI, so that we can legally take the information about digital address, email, and all those other things. I have every reasonable basis to expect or to anticipate that Parliament, in its wisdom, may find it necessary to meet at such times or on such days as would ensure that this amendment we are seeking to the form is passed in time to enable us roll out before the end of this year. If that doesn't happen, worst case scenario, early January or mid-January 2018, we will roll.
Parliament's Youth and Sports Committee, Alex Ejekum, has dismissed concerns by the minority that the National Builders Corps program announced in the 2018 budget will be job for the boys. Finance Minister Ken Oforiatta told Parliament the program, which will be implemented by the Office of the President, will employ 100,000 graduates next year. But the minority says it will only benefit MPP members. Here is Mr. Ejekum's reaction.
Why do you say job for the boys? Job for the boys, they are all Ghanaians. Whatever medium, whatever means that will get our youth into that arena of they calling themselves not unemployed graduates, but rather getting something to do, where at the end of the month they will get some income. It's all Ghanaians. So they are talking about institutions that are already there. We need to strengthen them. I'm a chairman of the Youth and Sports Committee. I know the challenges that the NYA are facing. Out of the 116 districts in the country, they have a little less than about 50, almost 55 or so districts that they are operating. So do we say that we allow ourselves for 116 districts to be created by the NYA before they start? Or we can't do that. A government which has been voted into power, there are certain initiatives that when it considers to be very critical in executing the particular agenda, they are free to do so. And I want to advise them, if there is any opposition party member who feels that in his or her constituency, there are some, of course I know that there are some. Let us see the government, how it is going to roll out the criteria for such recruitment. Get your list, let them go through the same procedure, and let's see whether they are going to say, because you are a member of the minority, once you have brought this list, we will not attend to that list.
As far as you are concerned, it will be a transparent process.
It's going to be so. It's a government for all the people, and this is our youth that should be the focus, not because you belong to this party.
And that's it for the AM News. You know, we have a lot more news on myjoyonline.com. We'll be touching base with our website pretty shortly. It's a takeover. It's a Children's Day today. And Ayeyi is from Christ the King and Seth from the Youngsters International School joining me to do the AM News. How has the experience been for you?
It's very fun.
Yeah? Is
Yes.
it? You've just been smiling all the way. Seth?
It's exciting.
Yeah? Okay, so we'll come back. Don't leave me. I want you to stay with me. Right now, though, we want to cross over to the forecourt of Joy FM, where our colleague who passed on sadly on Saturday morning, there's a short service in memory of him this morning. So I'm taking you right over to the forecourt of Joy FM. We'll come back and we will do a lot more stories. We'll look at what's happening in the newspapers and online as well. You're watching the AM show. Please do stay with us.